Dual Diagnosis, Treatment and Assessment, Chapter 15, Psychotherapy for Persons with a Dual Diagnosis. Handbook on Dual Diagnosis, 4th edition. Psychotherapy for Persons with a Dual Diagnosis. Psychotherapy in the past was not thought to be effective for persons with dual diagnosis. Today, some still feel this way. However, psychotherapy and applied behavioral analysis play important roles. It's a comprehensive approach. Current practice has shifted to best practice. The current focus has gone from, can people with developmental disabilities benefit from therapy? To, how can we make therapy the most effective for this population? What is psychotherapy? Counseling, training, group work, support, based on psychological principles and applied planned practices. Must be trained to use them. Purpose? To help people change feelings, attitudes, values, and behaviors. Therapy is individualized, direct, and face-to-face. Psychotherapy is not interventions designed by staff. It is not behavior therapy, or programs designed by a behavioral clinician or therapist. It is not based on nursing care plans, and is not based on case management plans. Does psychotherapy work? Research completed by utilizing case studies. The findings? Psychotherapy resulted in moderate change and is moderately effective. Psychotherapy is widely used in the United Kingdom. Psychotherapy is the only alternative when behavioral approaches do not work. Need better research at scientifically acceptable standards. Principles regarding therapy. 1. Success in therapy does not depend on the person's intelligence. Therapist needs to be creative in adapting the process to meet the needs of the individual. 2. A positive relationship is vital. Successful outcomes depend on the nature of the relationship between the clinician and the person. 3. People with developmental disabilities are more like us than they are different from us. 4. Transference and countertransference issues are more pronounced. Transference. Person reacts to therapist with emotions they originally felt in childhood, typically towards parents or primary caregivers. Countertransference. Therapist's redirection of emotions toward the patient in role of rescuer or parent. Principles regarding therapy. 5. Adults are adults, regardless of mental age, and therapy should be provided with this in mind. 6. Therapy should be separated from the rest of the person's life, not reported back to family or staff. This would be a breach of confidence or consent. No fear of consequences. Must be conducted in a safe environment. 7. People with developmental disabilities have been taught to be compliant, dependent, and good, passive and obedient. Self-sufficiency is the goal of therapy. The therapist needs to be persistent, to investigate what happened in the person's life, what they feel, and their goals. Adapting therapy for persons with dual diagnosis. 1. Understand the person's needs. Use model called MATCH to assess person to better understand their needs. Memory, attention, thinking skills, communication, higher order cognition. The therapist must build a relationship to better understand the person. Family support staff can support the therapist in gathering information. 2. Ensure the person understands therapy at the initial meeting. Introduce self. Explain job of therapist. Explain the purpose of therapy sessions. Review logistics. How often, how long. Emphasize the confidential nature of the sessions. Explain what type of therapy will be occurring. Tools used in therapy. Protocol. Describes information about therapy. Worksheet. Used to prepare for next session. Therapeutic contract. Establish goals for therapy. 3. Adapting therapeutic process. Persons with dual diagnosis require flexibility and adaptations such as shorter sessions, modified environment, reduced distractions, provide additional time for responses, add breaks, include non-therapeutic activities, go for a walk, get a beverage, etc. 4. Be concrete. Use concrete, seen, heard, etc., not abstract concepts. How anxiety makes the body change rather than abstract feelings being uptight. Therapy can include picture communication symbols. Modeling. Angry face looks like this. Relaxed face looks like this. Goal is to ensure person's understanding. 5. Simplify communication. Eliminate jargon, slang, idioms. Avoid metaphors. Laughter is the music of the soul. Use short, simple sentences. Be clear and straightforward. 6. Use multiple communication methods. Sign, gestures, pictures, videos, acting, music, photos, concrete objects. 7. Constantly clarify. Seek regular feedback. 8. Be directive. Therapist is in control of the session. Agenda, working toward the person's goals. 9. Be consistent. Need consistency and predictability to understand what is happening. 10. Label and interpret. Therapist must listen and be empathetic to label and interpret emotions to help the person understand. 11. Use techniques effective with children due to powerlessness, dependence, cognitive skills. Caution, still need to be treated as an adult. 12. Incorporate activities to understand concepts and learn new behaviors. Drawing, dancing, practicing, homework, scrapbooking, role play, imitation, etc. 13. Address issues related to disability. How do they feel about being disabled? What experiences do they have to deal with because of disability? How do they feel about stigma and rejection? Need to value the individual as a worthy human being. 14. Recommend group therapy. Useful approach for dual diagnosis. Types of therapy. Pre-therapy, teaching feelings, role-playing, grief counseling, symbolic interactional therapy, brief therapy, relaxation training, assertiveness training, group therapy, anger management therapy, problem-solving skills training, self-modeling, cognitive behavior therapy, dialectical therapy, psychodynamic therapy, trauma recovery, imagery rehearsal therapy, non-verbally oriented therapies,